Hello and welcome to another video. In this video we will be talking about the treatment of the peptic ulcer disease, the various regimens that are used in it, the triple therapy, quadruple therapy and the modified quadruple therapy that will be discussed, and their mnemonic will be discussed. So first of all, in the treatment of the peptic ulcer disease, you know that you will treat the H. pylori if it is there with the antibiotics, and you will also give proton pump inhibitors. So the main treatment will always be combination of the antibiotic and proton pump inhibitor. Now the antibiotic, the proton pump inhibitor, you can use the omeprazole, that has very good efficiency. But the antibiotics that are used, there are different regimens are used, different combinations are used according to the resistance of the H. pylori. So the first of all, the first treatment that you use, that is the triple therapy. And the triple therapy, you can remember it by tacos. You all It's one of my favorite dish, so the tacos, you have to remember that. Now the tacos, in which T represent your triple therapy. A is for amoxicillin, so that is your first antibiotic. The second one is the clarithromycin, that will be 500 milligram. So you will use the amoxicillin 1 gram and clarithromycin 500 milligram. If you don't remember the amount, the amount, it is okay, but you just have to remember that in triple therapy it is amoxicillin and clarithromycin, and you have to use it twice daily for about 2 weeks. Then the next one, the PPI that you will use is omeprazole. So omeprazole you will use for 40 milligram twice a day, and you will use it for 4 weeks. So basically the PPI will be used 2 weeks, means it will be used during the antibiotic treatment, and the antibiotics are mainly used for 2 weeks, for 14 days. So if the peptic ulcer is less than 1 centimeter, if you do the endoscopy, and an endoscopy, the result shows that the ulcer is smaller than 1 centimeter, so you will just continue the omeprazole for 2 further weeks after the stoppage of antibiotic treatment. So in this way it will become 4 weeks. But on the other hand, if the ulcer is greater than 1 centimeter, so then you will continue the PPI for 4 more weeks after the stoppage of the antibiotics. So that will give you 6 weeks of proton pump inhibitors. So this is the triple therapy. Remember tacos, so you have to use in triple therapy amoxicillin, clarithromycin and omeprazole. The amoxicillin and clarithromycin for 2 weeks, whereas the omeprazole for 4 weeks. So that's your triple therapy. Then the next one is the quadruple therapy, and the mnemonic for it is combat. So you see, combat. So in the combat, the Q is for the quadruple therapy. Then O, so O is for omeprazole. Now O is for omeprazole, M is for metronidazole, B is for bismuth salt that will be used in it, and the next one is T is for tetracycline. So when do we use quadruple therapy? So we use quadruple therapy when the triple therapy failed to eradicate the H. pylori. So when there is resistance to the H. pylori due to the triple therapy, or if the patient is sensitive to any of the drugs of the triple therapy, then you use the quadruple therapy. Okay, so in the quadruple therapy, the combat, that we have quadruple therapy: omeprazole, metronidazole, bismuth salt and tetracycline. So again, this will be used for 2 weeks of antibiotics, and then after that 4 weeks if the ulcer is smaller than 1 centimeter, or if for 6 weeks if it is greater than 1 centimeter. After that, you have the modified quadruple therapy, that if the H. pylori is again resistant to the quadruple therapy as well, then you will use modified quadruple therapy, and the mnemonic for it is ma.com. So you just have to remember tacos, then the combat, and now the ma.com. So modified quadruple therapy include amoxicillin, clarithromycin, omeprazole and metronidazole. So again, the amoxicillin, clarithromycin, metronidazole, the antibiotics will be used for 2 weeks, whereas the PPI or metronidazole will be again used for 4 weeks if the ulcer is smaller than 1 centimeter, and 6 weeks if ulcer is greater than 1 centimeter. So that's all about all the treatment that we have for the peptic ulcer disease. And if the patient is still resistant to it, or if complication has occurred, then you will refer them to surgery for Billroth and all this type of procedure. But just remember the 3 therapies, the most important therapies of the peptic ulcer disease: the triple therapy, the quadruple therapy and the modified quadruple therapy. So you remember these 3, and you remember the mnemonic: tacos for triple therapy, quadruple therapy it is combat, and for modified quadruple therapy it is ma.com. The first letter will always indicate you the name of the therapy that is there. So thank you very much, and do subscribe my channel for further videos.